Rossini to stay, and I will invite the other presenters to join us here on the stage. We'll be opening now for questions and answers. Feel free to identify yourself when asking the question, if you so desire. And also the presenters may ask questions to one another to discuss their respective topic. Questions are free of charge, please.
First of all, congratulations, all of you guys up there. Phenomenal. Dr. Luchhetti, for being a mentor and getting young people to go into this route. It's phenomenal.
It was an easy task.
So I have a question, actually a little bit for both of you guys, but start with Rodolfo. Did you compare first-year medical students and last year? Meaning, did you compare the results? Is medical school uneducating these students in terms of empathy, or if the results are the same, is it once, you know, because you talked about specialty being the determinant of empathy more or less, but is that the person's own interest from the get-go, or through medical school they get guided a different way?
Yes, no, great question. As our sample size were like too small, and there was a great variation between years, among years. Like we had, I think, kind of 50% of our sample was composed of first and second years. 50 not, sorry. I think 60%. And we just had 12 students of the third year of the medical school. So that's why our t-test was not able we were not able to find a significant analysis of this result. But there are several other studies comparing the first, between the first and the fourth year of medical education. And they conclude that, yes, empathy declined over the medical education. And that's an interesting point to discuss and to study more about. You know.
Just we are working in Brazil with at least 800 students, and we are following these students to see if in Brazil we have the same data from US, if the empathy is going to decline or if it's going to maintain the same. But as a medical teacher, I can say you that we can feel it, you know. So we are now trying to see if the study reflects our personal reflections about that. But I believe we have the same results in Brazil also. But we are working on that.
Another important thing to say is that the empathy construct, like the most recognized empathy construct is the Jefferson scale of physician empathy. But all empathy scales have a kind of social desirability. You know, students answer what is desired then to answer. So that's something important too when analyze studies about empathy in medical education.
Hi, thank you, all three of you. It's wonderful to hear from you. Ms. Rossini, I was very happy that you talked about your master's research, and I hadn't heard about it, something like that, which was qualitative in the United States, a qualitative study. And I'd be interested to hear from anyone on the panel who wants to answer, but specifically Jean and Luchhetti and Ms. Rossini. What do you feel are the difficulties in having qualitative research in Brazil about the effectiveness of the Spiritist treatments? Because, I say that, some of you already know this, I say that as a believer, that it's an absolutely extraordinary paradigm. And I feel like the United States is behind Brazil, and Brazil is really the leader in bringing forth this paradigm. So I've been personally doing my best to just expose what it is and the value of it. but I've been frustrated because there is a lack of qualitative research. So I was just curious, would you please update me? What are your current thinking about why there is this lack and what the obstructions are to having more qualitative research?
Interesting, because when I was researching to find the same methodological study, I didn't find much here too. And the school that I was taking my master's degree, they really they contribute a lot with the spiritual field. And I think the fact that we don't have this, I think, for example, in my research that I did in a center, to prove this effectiveness is, I think it's a lack of a database, in more, I would say, methodological ways of that we can prove this, because in saying the spiritist side of things, that it is doing more scientific research or papers that we can find answers is not their goal. I don't know if do you agree with me? I think that's the most difficult things today. As a believer, it's easier to see the results, but when you need something more scientific to show the effectiveness, I think it's more, especially here, it's not easy to find.
Well, talking about the Spiritist hospitals now, we have a financial crisis in Brazil, so a lot of Spiritist hospitals are closing the doors. So that's a challenging moment for these hospitals. So sometimes it's difficult for these hospitals to do a research because they are trying to survive for the financial crisis and the healthcare system. It's difficult, especially the public healthcare system. So I think that's a problem with evaluating, with analyzing the Spiritist hospitals in Brazil. On the other hand, we have some therapies, for instance, the laying on of hands, the passe, that we have some studies that have been published in the last 5 years, clinical trials. So we have a clinical trial concerning passe in anxiety, anxious symptoms in volunteers, showing benefits. We have also another paper that has been recently published in neonates, in the pediatric population, another clinical trial. At the Federal University of Juiz de Fora, we are carrying out a study with passe in osteoarthritis, knee osteoarthritis. So I think we have some studies that are complex, that are robust, and that we are doing right now. So I think if on one side the Spiritist hospitals, it's a difficult moment, on the other hand, we have some new studies that are coming out with positive results. So I think it's a good moment for this, you know.
Thank you for the answer, and I just want to apologize. I don't mean to be challenging as if there's something wrong. And in fact, in my time in Brazil, it came to me that if there were two people that would come in front of a Spiritist center, and one would say, I'm hurting and I need help, and the other one would say, I'm a researcher, I'm here to do research, the person who needs the help would be accepted right away, pulled in to be given help. And the research is considered less important, which is certainly all about empathy and compassion. And that's one thing that I feel is Spiritism is so strong with. So thank you.
I have a question to Ms. Silvana Rossini. First of all, I'd like to congratulate you for the initiative of your study. And I would like to ask, you mentioned about 63% improvement with the spiritual treatment. And I'd like to ask if you could elaborate a little bit on the parameters that you use to show improvement.
To get to this number, we initially used the database, like I said, and the methodology we used was the qualitative and quantitative methodology. And we had the numbers of the participants, and only the factors that help, that why the reasons they are going to this seeking for this help. This was made from a questionnaire. In the first day, when the person goes to the center, they are asked a few questions. For example, if they have vices, they have religions, they are seeking, they are looking, they are going to the doctor, they are taking medicine. So that they pray, they have religion. So this was the factors we used to resume our research.
But I was interested in knowing how you measured improvement. Was just by their answers?
Oh, yeah,
or
sorry.
there was some kind of
Yes.
threshold?
After when they go the first time, and then they stay at least 6 weeks, and then the base was in their answer. We don't really measure week by week. We measure by the questions we ask them for the first time, and after 6 weeks, we ask them again how they're feeling, and the research was based on their answers.
Thank you.
Hi, my name is Gilberto. I'm into psychology, and I have seen yours, Mrs. Rossini, right? And others regarding the impact of spirituality into patients' improvement. My question is, are you aware of any studies, any research that will do a follow-up study on why that happens, why or patients with mental health in particular get better through spiritual treatment?
As I study, I haven't. What I can tell you is what we see most of the days that people that goes there looking for help, and we see their improve. But I'm not aware of a study in this. I don't know about Dr. Luchhetti, if you know, but I don't.
You are talking about spirituality as a whole, or spiritual healing?
Spiritual healing or spirituality as a whole, if there has been any follow-up study. I'm a Spiritist, I understand what we're talking about here, but it would help if we could, I would love to see some studies that will understand why the patients are improving through spiritual health.
Because we have spirituality as a whole, the religious beliefs and spiritual beliefs, we have a lot of evidence showing that those who have higher levels of spirituality and religiosity has lower levels of cortisol, have the interleukin 6, lower levels of interleukin 6, and have lower levels of blood pressure. So the mechanisms for spirituality as a whole, they have been studied in the last decades. So we have that. But spiritual healing is another history. We have a few studies that have assessed spiritual healing and what happens with that. So we don't have this data. But concerning spirituality as a whole, yes, we have a lot of mechanisms that are trying to show why a spiritual person has better outcomes than a non-spiritual person.
Just a question. Sonia Doi is looking to me. Well, is there any medical or nursing students here on this auditorium? No? Nursing, medical? No? Okay, thanks.
We're still open for questions at the same price. I will ask you to use the microphone for recording purpose, please.
I have seen a couple of weeks ago in a Discovery Channel about spirituality and medicine, and about a recent book too that is being published in a newspaper in Argentina about a doctor that is named Facundo Manes, regarding healing and the process of empathy and things like that. My commentary is that whenever you go to a bookstore, you see a lot of help in spiritual healing, or the Book of the Saints. In a way, recently, Mother Teresa was, let's say, very portrayed as a living saint, but she lives quite disturbing, having mental, let's say, darkness. My point is, we all know how much we need healing every day when we see homeless just outside here or in our way to work. But that spiritual healing, in a way, is been, I feel, kind of with a negative impact when you see the statistic, because maybe people don't reveal themselves that they are hurt. And so I was surprised with the 25 cases that Dr. Silvana just reported when she did the database. I would say that most of us here do have some kind of, anxiety, depression, and things like this. So it's a commentary, because I have seen recently a very kind of awareness everywhere, especially in newspapers. Most people can afford to read newspapers online, and maybe we cannot buy a book or find a research. But I thank you very much to all three of you, and the speaker in the morning, Dr. Lana. Thank you.
I just want to add a commentary of my answer to you, that most of studies which investigate empathy over the medical education are cross-sectional studies, and they compare from the first through the last year. And we need more longitudinal studies to investigate it, like that's why we need now. That's what we need now.
My name is Livia Uehara. I have a question for Dr. Luchhetti. My question for you is, how do you cope with those patients that are not open to a spiritual approach?
Okay, so of course we are not going to impose religion or spiritual beliefs to the patient. So the use of, for instance, the tool, FICA tool, the George Washington, Christina Puchalski tool, use a good approach to these patients, because it asks about the faith of the patient, and if the patient said, I don't have any faith, I don't have any religion, then the tool asks, so what gives you meaning to your life? So I think that's the question, meaning to their life. So I think we must be very cautious to not impose religious beliefs. That's a problem. And of course, if the person is really has a high religiosity, has a lot of religiosity, then we can discuss further this. But if the person doesn't want this, we need to be cautious. We can see what else can give meaning to the life of this person?
And my second question for you is, do you believe that the lack of studies that we have is because of the variables that we need to analyze in the spiritual realms are not touchable, are not good tools that we can have to analyze with our tools?
I think, for instance, we have at least 100 scales, I think more than that, to evaluate spiritual and religious beliefs. So I believe the tools are quite good. They can measure what they are intended to measure, you know. I think that's not a problem. And we have a lot of studies. I showed you 6,000 studies in PubMed. If you are going to look for, I don't know, for integrative medicine, you can see that it's almost the same results. So 6,000 articles. So it's a lot of studies that have been published. So I don't think we have a lack of studies dealing with spirituality and health. We have a lot of studies dealing with that. And of course, we have some problems with definition of spirituality, because spirituality is a term that it's not, if I ask everyone here, what is spirituality? Rodolfo is going to provide a definition, I can provide another, Silvana is going to provide another. So they are trying to standardize this concept. But we have good measures, okay? We are measuring what is intended to measure. So I believe that's not a big problem, a big issue in the field of spirituality and health.
I believe I saw in your results that there was some kind of negative impact of religion. I was just curious where that factors in. Is it a fear of going to hell or what?
Okay, good question, excellent question. Yes, we have good and we have bad results of, bad outcomes of spirituality, spiritual beliefs and religious beliefs. We have the religious struggle, when a person believes that God is punishing the person does not have the love of God anymore. And the studies show that the religious struggle is negative for your health. For instance, those that believe that God is punishing the person has worse outcomes, can have less survival, can have more depression, more anxiety, more stress. So yes, we have both sides. I can say to you that 85% of the studies show positive results. So higher levels of spirituality and religiosity are associated with better outcomes. However, 15% of our patients have negative results. So, good point.
My name is Rajesh Chavand. I am actually in the G2G consulting business. What that means is government to government. I just wanted to kind of learn from you. Thanks for sharing your experience and the kind of a roadblock you face to basically to spread this Spiritism in the medical schools. So if you look at the curriculum, the way each country has governed the kind of the curriculum, how they teach medical, in medical schools here in the United States versus in Brazil, versus in Europe, versus in Asia. One of the things is my personal observation is anything what you want to do in the society is pretty much governed by the bureaucrats, who run the country. So it doesn't matter how much you want to penetrate, you always get a roadblock by that country's educational policies. So don't you think that if we really wanted to spread this one, the awareness, before even you touches the medical schools, you need to go to the root of who really controls that education, to create that awareness. So I just wanted to know what is your personal experience. That's my first question, and I'll come to the second question afterward.
Yeah. Okay. Good point. And of course, that we have to. For instance, we have in Brazil, we have the MEC. MEC is the Health Education Minister there, ministry, né? And the MEC is responsible for organizing the curriculum of medicine. They give some minimum requirements for the medical learning in Brazil. So of course if we have persons there that can say, oh, spirituality is important, it's easier to be implemented in all schools.
Right.
Okay, I agree with you, of course. But we have also some, in Brazil, for instance, is the Medical Education Association. That's something like the American College American College of Medicine here. And we can discuss these issues there at the Medical Education Brazilian Association. And this association is related to the health minister. So we can discuss these issues. In Brazil, I believe we are in a good moment for discussing these issues, because we have the last Congress on Medical Education, the last Brazilian Congress of Medical Education, has a meeting that I participated, and other, Lydia, that was my medical student at that time, and the round table there was discussing spirituality and health. And so I think, yes, we can change based on discussion with other universities, with discussion with the medical association, with discussion with the minister. So it would be an easy way to do that.
So I think in short what we are saying that it should become their strategic priority to get that awareness, whoever is controlling that educational system. Unless and until that becomes a strategic priority of the country of which you are residents of, where you wanted giving this education to the medical student, that will not reach them unless it comes from the top. What we're trying to do is we're trying to do it from the bottom up, and it may not, and as I said, that because of the financial crisis in Brazil, these universities are struggling. So there should be a kind of a strategic priority to keep this awareness and training. Government should be actually proactively involved in those efforts. That's how I personally see it. But again, it's an effort has to happen at a little bit different level. The second question is more like the doctors who graduate, if they don't have the spiritual level training at all, like mostly in the United States and some other part of the world, they are more going towards on the materialistic side. They just wanted not treating the body. They just, how many patients they see it in an hour, they're just coming and going, hardly spending maybe 10 seconds, just to understand, what really the pain, this body, behind that body, there's a soul, So that doesn't exist. So that's very frustrating experience. A lot of patients, they get, oh, I went to this doctor, he hardly spent 10 seconds. Versus, yes, there are some doctors, they don't even ask what disease you have. They just basically ask how you feel, and they basically want to know the history. And that half of your, disease, whatever you're facing, is gone just by comforting that soul. But this is the kind of a thing, I think the problem, we see it in the day in, day out life, So it is a daunting challenge, for us as an individual who wanted to promote this awareness, this education. But one side is a system, the other side, like here yes, everybody says, oh, I paid this one to go to the medical school, and now I have to recover that, So they are more on the materialistic side. So that materialistic side versus the spiritual side, I think that's the one challenge we have, how we get that awareness. And the third thing is, if you look at the other part of the world, we're talking spiritism versus spiritual healing in the other part of the world. It's a two different thing. They are basically going through the Vedas and, So that training is completely different. So there is a kind of a disconnect. The people are not aware of that. So how we basically promote it, and can we able to leverage the platform, what is being created already on the other part of the world, so that we can reach to the many people to give this training. And I'll give you a few of the examples. I just came back from India, and I visited one of the, I think they have like 1,800 ashrams in India, more than 4 million people every year coming there for spiritual healing, more like meditation techniques. But they are not given this sort of a training. So I just want to know what is a strategic role we can play to leverage that platform so that we can get to the many people this message, what you are trying to do to the medical science, and bringing the spiritual science together.
Okay. First, concerning about spirituality and health, I think you can train the students from all around the world with some adaptations. We have recently compared Brazil, India, and Indonesia in a study concerning their opinions about spirituality and health. I can later provide you the reference. But it was very interesting because they are very different countries and with very different religious backgrounds and with very interesting results. So I think we have to discuss in an integrative way. Everybody from different countries discuss what should be the minimum requirements for a student to learn concerning spirituality and health. And after these minimum requirements, we can then have some peculiarities of each country. So in Brazil we have Spiritism. Okay, so we have to train the student to deal with this religious background. In India we have other religious leaders, or other traditional therapies. So the students must be aware of these traditions. So I believe we have first to do a core curriculum, an integrated core curriculum with the minimum requirements for this field of spirituality and health. Christina Puchalski has already tried once to do that. It was a very good paper at the Palliative Medicine Journal, but it's outdated now. I think it was in 2007 or 2008. So we need another meeting, another consensus meeting with these minimum requirements. And then, of course, with these minimum requirements, you can then adapt it to each reality. I think that's the way,
Yeah, there are 3 centers, I think they open in Brazil. One is in Sao Paulo, one is in Rio, and I don't know the third one. I just visited India, and they told me that, yes, we have, but I think their concept a little different, that more on the healing side than the teaching side. But thank you very much for your participation.
Thank you for your question.
Well, I should have raised the price of questions. One last one. We have to keep
I'll be the
track
last
of our
one.
agenda.
In
Please.
fact, it's more than a question. It's maybe for Dr. Sonia. I'm not a professional for the health area. I mean, engineer, also a spiritist. But I think one thing. Congratulations, everybody, for the work, especially the young guy, right? Bright future for you. And I think one of the things that is important for this kind of association, since the purpose is to bridge all the knowledge that you have in the Spiritism and also all the knowledge that you are collecting from the medical work and also all the research that you are doing, I think it's very important, the work that you did with the complementary therapy, right? And I think it's very important you can replicate as more as you can see, collecting data for the Spiritist Center. And I do believe that this kind of association that can help to bring the data, to put everybody involved, because in the end of the day, we'll be helping in the 2 things, because it's not only work with the healthcare professional, but also to bring information and data from what you are doing in the Spiritist centers. And I think both things together will be helping for I have a better understanding for the process in the near future. And thank you for everybody. Thank you.
Well, we have now a break, a coffee break, until 3:30. I strongly recommend that you get your books, get them signed. We have here pioneers in the area, maybe a future Nobel Prize in medicine, who knows? But before that,